Probably the most important thing you'll learn today is to recognize the patient who's getting into airway trouble. The commonest form of that is an obstructed airway, where the patient is trying to breathe against a partially blocked upper airway. This happens when the tongue falls against the floor of the pharynx and the patient cannot move air into his or her lungs. This sometimes looks like a rocking boat between the discoordinated breathing of the chest and the abdominal wall. It's almost as if a boat is tossing on the sea as the rocky breathing is uncoordinated. The next important problem with the airway is total apnea, when the patient stops breathing entirely. It's very important to recognize that. Usually the pulse oximeter will be desaturating at this point. I'm fond of saying that halitosis beats apnea, or that is, bad breath is better than no breath at all. So if the patient is getting into airway difficulty, it's important to administer oxygen and, if need be, support the airway by lifting the jaw or by doing bag mask ventilation with oxygen. Another important set of problems to recognize early in a sedating event are those with the cardiovascular system. With the heart rhythm problems, the commonest is bradycardia. This can be seen as a result of vagal stimuli. It can be a loss of the sinus mechanism, or patients can develop various arrhythmias. Often the wisest thing to do is just stop the procedure, wait before going on. Hypotension is not an uncommon event with the drugs that are used for sedation, and this usually responds to changing the patient's position or giving some fluids. It's very important that the physicians be involved if the patient becomes hypotensive, and that the drugs be monitored carefully. Rarely a patient will develop a totally obstructed airway or loss of the airway and or a loss of effective circulation. In that circumstance, there is no doubt but that a full dress code call should be made and a cardiac arrest protocol instituted. In that circumstance, the response should be the standard code response within the hospital, and the roles and responsibilities are those of the code team, and the documentation should be on the cardiac arrest sheet. It supersedes all that has gone before with the sedating process and its medication record.